Welcome. I am so happy that you have joined. Connecting in this way can not only feel good, it's good for our mental health and well-being, particularly in these unprecedented times of COVID-19. I'm also aware that there are a lot of webinars going on right now, and I am really appreciative that you've made the choice to join this webinar. My name is Dr. Kathy Kyle. I will be your MC today. I am a member of the Canadian Veterinary Medical Association Member Wellness Committee. And in my day job, I'm a technical services veterinarian with Merck Animal Health. Last year, I spearheaded the first inaugural Merck Animal Health CVMA Time to Talk About Mental Health in Vet Med Awareness campaign. And that campaign continues with a series of quarterly webinars, of which the webinar today is part of the series. The webinar today is particularly poignant because currently it is the Canadian Mental Health Association Mental Health Awareness Week, which started on May the 4th and ends on Mother's Day, May the 10th. And before I have the opportunity to introduce our amazing speaker today, I would like to go through 3 housekeeping items. The first would be that we're thirsty to hear from you, and you can place questions and comments in the question icon box. So the question mark is the first icon on the lower right-hand side of the screen. That's where you can place comments, and I will be keeping track of those comments and questions and providing them back to our speaker. And then the last icon is the attachment icon. It looks like a white square, and currently there should be 6 attachments there. If you've joined early, then you may need to refresh your browser in order to see all 6 attachments. Don't worry, we'll go through and we'll talk about the value of the attachments as we go through the webinar. And the third point is that this webinar is being recorded, and it will be posted on the Canadian Veterinary Medical Association website early next week under Member Wellness Resources, and the subpage is Webinars. And I'd like to provide a huge shout out to Lori Tarbett of the CVMA. Lori's been instrumental to help me with this webinar. She sends out the invitations to each of the provincial veterinary medical associations to be cascaded to all members. And she also helps in the background posting things like Coral's PDF of the presentation that she'll be doing today along with the webinar recording. So without further ado, I am super excited to introduce Coral. And there's Coral on the screen. Hi, Coral. Coral Doherty.
Hi, Kathy.
Hi. Some of you may know Coral as Coral Greenwood. Brings over 20 years of career experience into her role as a certified psychological health and safety advisor. Coral also received her diploma in quality management in 2019 from the University of Manitoba. And as such, she brings a philosophy of continual improvement into the implementation of psychological standards into workplaces. Coral has worked within small, mixed, and equine practice. Her role as a sales representative for 10 years allowed her a window into many different types of practices across Canada and in the UK. As an RVT, Coral has seen the mental health dynamics that occur on a daily basis. Now that the veterinary profession has processed and recognized the mental health risks associated with working within the veterinary industry, the next question is, what's next? And that was really Coral's aha moment. What can practice managers and teams do to mitigate these known mental health risks? And Coral realized that practice managers need tools that provide the mental health care system within their own practice and the ability to implement that system within their practice, recognizing that a healthy workplace involves both mental and physical health. The Canadian Standard for Psychological Health and Safety provides the roadmap to ensure practices are able to comprehensively implement all aspects of a psychologically healthy workplace. The standard infuses all levels of management and accounts for worker responsibility to build and continuously improve mental health on a day-by-day basis. This webinar offers everyone the opportunity to recognize the 13 factors that affect psychological health and safety. Welcome, Coral.
Thanks so much, Kathy, and thank you to you and the Merck team for inviting me to share this webinar with you and share this information that is so current and important to veterinary medicine. Before I get started, I'll tell you a little bit more about my certificate as a certified psychological health and safety advisor and what it actually means that I can do for practices. And in this webinar, the hopes that I can share this type of information with everybody. So I'm able to assess the readiness for change of practices, and it's really important when it comes to something like this because there needs to be some flexibility and some interpretation as well as where a practice is at and how they're preparing and they're ready to make any changes. Also to commit to the overarching principles of the Canadian Mental Health Association as a psychological health and safety advisor. So there are some specific criteria and guidelines for that. And I can also assess the readiness for change, applying those principles, and then prepare employers to proceed with implementing a psychological health and safety policy at their workplace. I can apply tools and assess and analyze the data that comes with developing a plan and seeing what needs to be changed or improved. I can also give and accept feedback from managers, shareholders, practice owners, all levels of veterinary practice. And I can also present the business case to employers, go through an assessment process, and also implement plans. The great thing about my background in quality management is that it helps me to really apply the concept of continuous improvement and process management to the implementation phase and just the overall assessment of where this practice may or may not need to change or improve something to apply the psychological health and safety policies. So if I go to our next slide here, was working on what was the best way to explain what these policies are going to do. And I think at the end of the day, what we want is we want everybody to have the opportunity to win at the long game of our careers. So the Canadian Mental Health Psychological Health and Safety Policy provides a roadmap, a very specific roadmap that's adaptable to any size business, and there is a specific one for healthcare settings to ensure practices are able to comprehensively implement all aspects of a psychologically healthy, safe workplace. So one of the things about that, as I go to our next slide here, is that it's an idea, it's a concept that's going to build and continuously improve. So once you have a policy implemented at your practice, it's usually best if you keep the mindset of continuously improving and adjusting it to needs.
I think we've lost your volume, Coral. We've lost your volume. Just refresh your browser. Hang tight, everyone. We're hoping to get Coral back.
Are we back?
We're back. I'm so
okay,
grateful.
Good.
Thank you.
Okay, good. Yeah, no problem.
I practiced a bit of mindful breathing there. So,
yeah. That was good. It reminded me of the picture that you posted on there because my son was asking me how old I was in that picture. And I said, it was just last year. I said, well, it has been a bit of a rough start to 2020, so maybe it's starting to show.
Yes, I think it's hard for all of us, particularly with COVID-19. Yeah, and maybe exactly. This is a good time, Coral, just to remind people that as you go further and you talk about psychological safety, that can unearth feelings and emotions, and those can sometimes get the better of us. So Coral and I do want to remind people that there are resources to help in these times, and those resources are posted as an attachment. And that first slide also called out that Homewood Health right now, and thank goodness for Homewood Health, along with Health Canada, is providing mental health resources free of charge to all Canadians, including counseling. Can either be one-on-one counseling, group counseling, peer support. And those text numbers were on the screen. And if people simply Google Homewood Health and Health Canada, the portal will come up that people can join and register and have access to all the mental health support. And then I've also, for the mental health campaign last year, developed 2 documents. One is in English, one is in French, that has the Employee Family Assistance Plan phone numbers of all the veterinary medical associations in Canada. So again, if people need that help and it is okay to reach out and ask for help, check the resources on the resource tab of the webcast portal.
Yeah, for sure. And I'm glad that you mentioned that, because I'm going to touch a little bit on those type of employee usage of those type of resources and where that fits in with the mental health and wellness policy as well.
Wonderful. Thanks, Carl.
So I'm not sure where if anybody had missed, but there are 4 phases to actually implementing policies at your workplace. I'll talk about a few of the steps, but I don't want you to get overwhelmed, and we'll just take one step at a time, one day at a time, because it can be really overwhelming. Sometimes I get really excited and kind of passionate, and then I talk a lot. But today I'm going to try. I'm going to try and stay on my notes here and keep myself accountable. So there are 4 phases to start initiating the standard. I'll outline those 4. So the first one is leadership commitment, and I want to talk about that. I want to touch on that today, but I want to go into more depth in the future on that specific step, because it is so crucial to its success. And number 2 is to establish your baseline and collect the baseline data. I will also mention a tool on how you can do that for your practice. Develop your vision is number 3, and set objectives and a timeline. So I will talk a bit about that too. And number 4 would be a planning of how you're going to implement the policies. The next phase, and really the white noise in all of those phases, is really the mindset of continuous improvement. Nothing is written in stone, and even if there's a stumbling block, we can always learn and try to improve our process with that. And the one great thing about this policy, this new standard, is that it allows an auditing tool. So an auditing tool allows you to see if the policies that you've put in place are effective and they are pervasive across all levels of management, and shows the commitment, ongoing commitment to all levels of authority for implementing and maintaining this type of a policy. Okay, so let's go to the next slide. Now, one of the things that, as you mentioned, Kathy, there is still sometimes, I still hear and I get the thought about a stigma about mental health and wellness. And I think that today it's exciting to have everyone here, because we're all starting to talk about our struggles. There is a reduction of our stigmas, and it's people like yourself, Kathy, and Dr. Marie Hollowaychuk and Dr. Andy Rourke that have been talking and bringing awareness about mental health and struggles in the veterinary medicine field, especially in healthcare as well. We're exposed to grief and trauma and loss at one moment, and the next moment we're supposed to have a smile on our face and welcome a new client with a little puppy or kitten. The next appointment, something traumatic happens, and I know that you all know the story. Does anybody have some examples, Kathy, that they would like to share, maybe about what they have seen as psychological hazards in their workplace?
Yeah, great question, Coral. And currently, I don't see that anyone has put anything into the chat. However, I do invite all of you to reflect on that. And if you've been exposed, as I'm sure many of you have, to psychological hazards, those mental health stressors in your work environment, please take the opportunity to click on the question mark and then put your comments in the chat box. And then you'll click to everyone, and then I'll keep track and let Coral know.
Right. Sometimes these things creep up and we don't realize that we're becoming burnt out, or that we have compassion fatigue, or we're experiencing secondary vicarious trauma. Just as an example, in one of the workplaces that I was at, during a routine procedure, an animal struggled, and it was an employee's animal, and we did CPR, but it was unsuccessful. Now that for that employee's owner, that was a very stressful event, and self-care and resilience would be really important at that time. So that would be another tangible example of a psychological hazard.
So currently, yeah. Coral, there are no comments in the question box.
That's okay. Yeah. Yep. And at any time, if there is, you could just let me know.
Absolutely.
Yeah. So developing a workplace mental health policy really needs to start with reminding and keeping in mind what are the factors that contribute to a mental wellness policy. One of the things that happens in our career is that we're spending 60% of our time with our colleagues and at our workplace. Mental health is so very important, and accountability for everybody to maintain an environment of protecting and promoting mental health and wellness is one of the opportunities actually right now that this policy is giving us to be able to make some changes at our workplace. We know that our coworkers and ourselves are exposed to the mental risks of working in the veterinary profession, and we can now, there are tools that are available to help us uphold and care and protect workplace mental health.
So Coral, I'll just stop you there, and I do see a few comments now coming in. Thank you. One comment is, right now we're often working shorthanded and it's causing staff to natter, and that tends to be a snowball effect that hurts their mental health. And Cheryl has also added a question, ideas to get around this.
I have actually some, I'm glad you mentioned that, because I have a policy example that specifically talks about what type of a policy, how can you design a policy that makes everybody accountable for mitigating and, well, really stopping workplace gossiping and, talking behind each other's backs or being passive aggressive. Toxic workplaces, I guess, is a nice overall term for that. And they do exist when people work together. You need a manager. As long as people work together, there's a need to combine all types of different personalities and overcome problems in order to come to solutions and bring harmony. And I think policies are one way forward, because everybody will know about them. Nobody can really say that they didn't know, because it will become part of the culture. So I'm really glad you asked that question, and I'm going to address it in more detail in a couple more slides with you.
Wonderful. Thanks, Coral. And then one other comment. Susan writes, working in corporate practice without the owner in the building can put excessive stress on the managers and leave staff feeling unsupported, and that they are only working to support middle management.
That's a good point. I know that this type of a standard that we're talking about today, the first stage and the biggest and most important step of the whole policy is actually including top management and senior management. So the greatest thing about this type of a tool is it's designed to affect senior management as well as the frontline workers. And so everybody is accountable. So whether or not the owner or the leader as a part of one of those corporate practices is there, the policy is so in-depth and so complete in all levels that it really, really helps to keep everybody at the workplace accountable, whether they're there or not. So I feel really positive about this. I'm very excited about this tool, but I think sometimes we just got to think baby steps. And I really want to work at helping everybody feel more comfortable and confident about approaching leadership, to talk about these things. And I'm thinking that maybe in the future that might be a great focus for us to go spend some more time talking about. So first of all, I wanted to touch on what are the 13 factors that address mental health in the workplace. Number one, and everybody's talked a lot about this recently, is organizational culture. That is something that sets the tone for things like what you were talking about corporate practices as the culture at that practice, psychological and social support, clear leadership and expectations, just being civil and respect to, to everybody who's at the workplace. There are psychological demands, and being aware of them and sharing the psychological demands that are affecting you at that time. And each one of these 13 factors is reflected in this Canadian Standard for Workplace Psychological Health and Safety. It's comprehensive. It covers all of these 13 factors, going into detail on recognition and reward, involvement and influence, the workload management, so hours of work, engagement, so from leadership to those workers on the front line. And also talking about work-life balance is so very important, especially, now, but it always has been, because, veterinary medicine, it happens at all hours of the day. And usually the cows and the horses don't choose to need our care in normal working hours. But the balance must be that we're all human beings, and we need time away from work as well. And we need to feel comfortable in stating that we're struggling with our work-life balance. And that's really important in these 13 factors to address. Psychological protection. And what the really neat thing is, like, the most obvious thing for everybody is to understand protection of physical safety, because that's almost like a no-brainer. We know we got to do certain things, that we don't get bit by a cat, we're not exposed to waste anesthetic gases. Those are obvious things. But psychological health and safety is like a lead apron for your emotions and all the encounters that we have throughout our day, the ups and the downs, the traumas and the joys of being in veterinary medicine. So, it's a policy that protects yourself as a worker, but it also would help you help a coworker who's struggling, because I've heard people are sharing stories with me about not just themselves, but they're really feeling for a coworker, and a workplace mental health policy will help you help your coworkers. Okay, I wanted to just touch on what does a healthy workplace look like? It would center on the value and ethics. If you can imagine a circle that says do no harm to others and ensure employees' health and safety. Off that circle spins the affected items that are happening in the external environment, like physical work environment, psychosocial interactions and teamwork, and also your own personal health and wellness. So that would be ideally a healthy workplace is one that centers on values and ethics of their employees.
So, Cora, let me take this opportunity just to ask you, why should veterinary practices care about psychological hazards and looking at implementing the standards?
Yeah, you're right, Kathy. I mean, to be honest, I've been asked this question before, and I've had this question, and by nature, it's one of the easiest things to do is nothing, right?
Yeah. Mm-hmm.
Yeah. So, but it's true. We are losing talented people. We're losing everybody in our workforce to things like burnout, compassion fatigue, illness, like mental health illness and struggles. And just because you have a mental health illness doesn't mean that you don't have mental health wellness. Because an illness doesn't mean that you have a problem. Sometimes it actually just means that you needed the help, you got the help, and you have mental wellness. We want to, stop losing our talented vets and techs and our managers, and the forever feeling of being shorthanded, because we're professionals that are burnout and tired. We're seeing more studies coming out that are continually supporting that. We do need to do more. We recognize that we need help. Now, I'm so excited to share this tool, because I really think this is one thing that's so adaptable, is so amazing. And Canada is the only country in the world that has it. So how awesome is that? Like, really.
Super awesome.
And you know what? There's 4 main areas of consideration that make up a business case for implementing the workplace health and safety policy. But I want to touch briefly on the values that the management would share and uphold. As you reflect and you look through this list, I'm sure that you can kind of put yourself back in your workplace, and you can visualize a moment where even an equity focused management would have helped you in a mental health struggle. If you're dealing with compassion fatigue, if there was something, a policy that would have helped you be able to feel comfortable and as an equal to speak to management, to talk about these things. Partnership driven, recovery oriented, a relationship and person centered management that focuses on the strengths of their people and keeps them informed when there's traumas and doesn't leave them in the dark. It's an accessible and inclusive type of management, a no secret management. People start to really feel more comfortable working there. I'll talk, one of the biggest and most significant impacts of working at a workplace that has my psychological health and safety policies and adopted the Canadian National Standard for Psychological Health and Safety. It's such a mouthful, but it's so important. We see happy teams that are optimizing business success and prosperity. We're seeing reduced staff turnover, reduced sick leave, reduced accidents, and reduced pre-absenteeism. You know what? I don't know about you, Kathy, but when I first heard that word, I was puzzled. Have you heard that word before?
I've kind of heard a similar word, and sometimes it's the way people describe it. They say people are at work, but not really at work. And I think
right.
Work, psychologists, organizational psychologists would call that presentism. It's a mouthful too.
No.
And, I've talked with RVTs and veterinarians too, who maybe they've had an overnight shift or they're showing up to work the following day, and I'm sure we've all said things like this, like my head's not in the game, or I don't feel like I'm on top of my game today. I feel brittle. And sometimes people might even fortune tell and say, I think I'm going to be making mistakes today. And that's how I see, being at work, but not being really present at work. And,
right.
I would think in those situations, taking time off work, if one can afford that luxury, would be the absolute best antidote. And then it maybe also is requiring some extra support, either physical support or mental health support.
Yeah. That's right. I often hear that these are the times also with pre-absenteeism that people are being quiet and internalizing their mental health struggles because they're still having that stigma in front of them that if they talk about it, it's not good, that they shouldn't be sharing this. They're just going to be told it's going to be fine. Everything will be great. You'll be all right. You'll just deal with it. Well, it's interesting because, we're talking about Homewood Health earlier, and all the provincial veterinary medical associations are subscribing to the Homewood Health program. And the interesting thing I found out, one of the most interesting things I found out with my training is that we think that if our employees are not accessing Homewood Health or our employee assistance programs, it's a good thing. We think that it means that we don't have problems. The proof, actually, the data is showing us if you don't have a lot of your employees using your Homewood Health or your employee assistance programs, it actually means you have a higher incidence of psychological struggles, mental health struggles, because people are keeping them quiet, they're keeping them to themselves, and they're not reaching out for help. So you'll have a healthier workforce when you have something in place to encourage your employees to access those type of resources on a regular basis, and they're free and they're private, they're confidential, and they're just great tools. I wanted to talk a little bit too about the fact that your clients are going to notice how.
Oh, we've lost you again. Refresh time. And as Coral refreshes, let's see if she's back. Can we hear you?
Am I back?
Ah, yes, you're back.
Okay, good. So I live in rural Manitoba. I love it out here. There's lots of fresh air, lots of space. but not as much internet.
Everything comes at a cost.
Yeah, that's right. So anyways, the bottom line for practice owners is ethically sound practice management, and obviously a profitability would be better, but the staff would be happier, and just business success would boom. It would just be amazing. So I want to give you an example and just allude back to somebody had asked a question about gossiping. So here's an example of how a policy in that type of a situation where you're seeing either a high staff turnover. So if you're tracking your high staff turnover, you're always seeing new employees come to your workplace. You're always having an ad out because you want to have new employees come because you know you're going to lose somebody. That would be a high staff turnover. There may be situations of workplace bullying or harassment, setting unrealistic expectations or working hours, no work-life balance, and gossip. Just the negative chatter, as you mentioned. This policy would actually outline how staff that are aware of the situation or affected by this situation can give feedback and report either a critical event or just advocate for themselves with confidence that the organization would take appropriate action and they would be taken seriously. I think sometimes out of the fear of not being taken seriously, or after, in the fear of not saying anything at all because you're afraid, the policy would make it clear that management and everybody on the team is accountable. And when all staff are aware of the policy, they all know where to go for help. So hopefully at this point, everybody's thinking to themselves, this is really great information, but I really need to know more about how they could actually work, how these mental health policies work, and what needs to be done to try and get there. I've made it into 4 points just to keep in mind. Number 1, as I mentioned, leadership needs to be fully engaged. One of the ways we can do this, and it's part of this Canadian National Standard, it's an actual statement that is signed by practice owners or senior management or corporate. So it's a policy statement that's actually signed. It needs to clearly define what the plan is, a commitment and systematic approach to managing health and safety at work, psychological and physical. It needs to be short. It has to be a short statement, and it's something that should be shared with the whole workplace. That way, it shows the commitment and leadership and the essential factors for organizational success in the standard. It also informs them, the whole team, and all those who are involved, what the details are, what the steps are going to be, and addresses any potential fears of any type of change at the workplace. It's just natural. We're humans. We fear change. So give us more information about what's going to happen. Management needs the time to implement the practices and the framework that's required for success. And one of the big things in that is management needs enough time to establish baseline information. What are we doing right now at work that's great, that's working for us, and what sort of things do we need to change or improve? The frontline staff are also integral to success, and just knowing that you're working in a camaraderie type of environment where everybody is working towards workplace mental health and wellness becomes a foundation of knowledge for everybody to know more about mental health policies at this time. The best thing for those who are listening today who want to share the information at their workplace is a link that I've included here called havethetalk.ca. There, actually, you'll find...
Oh, we've lost you again, Coral. So Coral will refresh, and I'll just remind people that I've created a list of a document that has all the resources, which Coral will be referring to, including havethattalk.ca. So it's in a document in the attachments called Resources for Coral. So again, download that one, and there's many resources, including live links in that document. Oh,
There's
okay,
lots.
you're
Am I
back.
back?
Yeah.
Okay.
Yeah, you're back. Wonderful. Oh, and now we've lost you again. So we've lost Coral again. So what I'd like to do is just go, as she refreshes, go back to the chat. And I see that one person has mentioned, and thank you for this, a good example of pre-absenteeism is people who are complacent at work. I'm just scrolling down here, Coral, if you're back, just to an example of, thank you, pre-absenteeism can be perceived as being complacent. So losing passion for the work. And that's a very good way of looking at it and a good way to define it, right?
Yeah, absolutely. You're absolutely right.
Okay.
For sure.
And then I'm seeing a few other comments. So let's just go through those now and then we'll head back to the slide. Stephanie says she works as a RLAT in a research facility, and sometimes at the end of a study, we must humanely euthanize a large number of animals. This is always difficult on myself and my colleagues. With COVID, it was required to reduce numbers in our research facility. That was difficult for us to deal with. And I'm sure, Cole, your heart is going out to Stephanie, as my heart is too.
Yeah, it is.
And I think of a self-compassion methodology that a psychologist named Dr. Tara Brach uses. Her last name is B-R-A-C-H, and it's called RAIN. And it's all about recognizing, acknowledging, inquiring feelings and emotions, but then also nurturing oneself in these times of struggles, including what Stephanie is going through. So I would encourage anyone to just Google RAIN, R-A-I-N, and Dr. Tara Brach, and you'll see some good resources on how to utilize that in times of distress and stress. Anything else to add to Stephanie's comment?
I was going to say this is a very present moment for Stephanie to reflect on that. And she should use that energy that she has to call Homewood Health. Because they have people on the phone that are going to help her get through this. You don't have to do it alone. That's why these resources are there for us. And, we always think in our head, oh, we'll be okay. We can deal with this. We can cope. We're professionals. Everything will be fine. But you try it. Just try it this time. Call Homewood Health and share with them what you're feeling. And sometimes just sharing that out loud relieves your heart of that heavy burden too.
That's beautiful. And in fact, I was on a Homewood Health webinar that the Alberta Medical Association put on. I'm a member of the ABVMA. And the psychologist on that webinar talked about things like RAIN and Dr. Tara Brach. So touching base and being able to talk with these counselors not only allows the hearing of what one is going through, however, also some strategies and solutions too.
Yeah, definitely.
I see Tom has written, at one practice I assisted, their cold storage freezer was located in the main hallway entering the treatment room. Every time you walked into the treatment room, you were reminded of all the pets you've recently euthanized. To avoid secondary vicarious trauma, keep freezers out of sight in the back room. Amazing recognition and acknowledgement of what is going on, Tom, and then a solution providing opportunity too.
Yeah. Euthanasia is, sometimes it's a very personal experience that we don't find words for sometimes. We can't express what it is that we're thinking and feeling inside. But the mental health policy, the standard, will put those words into perspective, and it'll address the needs of everybody without them having to say a word. That's the nice thing I really like about it. It's just so proactive. And it's so comprehensive that it's there for everybody.
Wonderful.
Yeah, it's great.
Well, thanks, Carl. I'll let you go back to the presentation and then I'll return to the chat later on.
Okay, that sounds good. I think I had left off with the policy statement that needs to engage the senior management and make them accountable. And the link for havethattalk.ca has 13 really great videos that you can use to share this information with either senior management at your workplace or with your coworkers. Sometimes a couple of, don't do it alone. Try and engage your colleagues so that you can all say, hey, like, we recognize that we all want to have this. This is the information we've learned about the 13 psychological factors that are affecting our workplace. and we want to share this with you. So these videos are so informative. They give you a totally different perspective. I found them really enlightening. The next step would be that management develops a management charter to show the plan. It's like the actual plan, and keeps the management accountable for implementing a mental health policy, the standard at work there. I have an example of a policy statement. So a policy statement would sound something like this. The standard is about having an action plan to reinforce workplace wellness practices and behaviors in order to build and sustain a healthy, respectful, inclusive, safe, and productive workforce. Specifically, we will demonstrate the entire executive's commitment to this initiative, work with all of you to explain the standard and how together we can make it a reality, build on our survey results to identify key areas of focus, raise awareness of tools and services available, offer mental health first aid training more broadly, and create an action plan and report regularly to you on all of our progress. So that's actually a statement that is that's a public document from the Corporate Services Branch of Health Canada, if anybody wants to see that. So I had mentioned about, I wanted to really touch about something that's current in all of our lives right now, and give you a resource as a manager or senior at your practice, either corporate or practice owner, of tools that are available right now to help managers care for those people who are caring for others. So there's the link there. And two of the main factors out of those 13 that are so important that if I was to say, here's your low-hanging fruit, these are the things you should really take a close look at in any of your policies and development right now, it would be self-care and resilience and clear leadership and expectations, which means that there should be a plan, a communication. Everybody should, the leadership and team should empathize and reassure those workers, understand what they're feeling and what they're going through, and recognize that this isn't business as usual. Kathy, have you heard anything recently about the COVID-19 impact on mental health?
Well, I'm hearing, both at work as well as at home with respect to the isolation. So either physically distancing or self-isolation does have an impact on mental health and well-being and can exacerbate underlying conditions. So I think that's just another call out to reach out and either talk with people and or use an employee family assistance plan. And now that we have Homewood Health and Health Canada offering free one-on-one counseling or group counseling or peer support, that to reassure people that it's okay to reach out and talk. Right. It can feel scary at times, and it's scary perhaps to reach out and get help and think that you're being labeled with something or that you should be able to cope. However, it feels like a weight is lifted off your shoulders when you are able to talk it through, not just with another person, however, with someone who can provide some strategies to help.
Mm-hmm. That's for sure. I think I'd heard that there was a webinar where there were some workers that were feeling very distressed that they couldn't put themselves at risk to stay and work in the environment, the work team. Mm-hmm. And I think the word was moral distressors.
Right. Moral distress. Yeah. People, right, especially from RVTs who have chosen to stay at home because of perhaps being immunocompromised and feeling guilty that they're not there to be able to help their coworkers. So if you're in that situation, know that those feelings are okay. They're normal to have, and they actually show that you have a lot of care and compassion. However, in order to provide that care and compassion to others, it really starts with filling up your own tank with self-compassion and taking some time for yourself, and then reaching out to your coworkers, even virtually, to say, what can I do from home to be able to help you?
Yeah, that's for sure. That's for sure. Is there any chat there about COVID-19 at the workplace?
Not COVID-19, but there was just one moment. I'm going to go back to the chat window, and there was a gentleman named Danny who asks a question: how to deal with an employee stressed out with unfair attacks that comes from his or her professional order association, how to reinsure motivation to this person.
Right. And I hear that there are some situations that we've come across where you almost need a higher authority to turn to in these type of situations that would have their own code of ethics and policies that would enforce mental health and wellness, and an approach that is cognizant of adhering to a code of ethics or standard for workplace mental health, and those people in your profession, that they also adopt this standard. The standard itself, it is something that is very robust. It took years and years of research for it to be developed. I'll speak a little bit more about that in detail in just the next slide here. And it would be something that if at this point right now, it's not mandatory that you have this, but there is movement towards it being something like a physical health and safety policy that is required at workplaces. There is room for that movement to go into something that is actually applicable to all workplaces. So I'll talk a little bit more about that too. I think the tools that are available through the Mental Health Commission of Canada and Canadian Mental Health Association are great tools to fall back on and ask these type of questions to, and that's for that person in that situation where they're feeling like they're being sort of cornered or targeted or isolated, I guess, from the professional association. I hope that answers your question, and if it hasn't, please reach out to me. My details will be available for if there's something I can help you more specifically with in regards to that. As I move forward on the mental health and wellness policies and the standard itself is designed to identify, control, and support and promote psychological health and safety. It makes workplace culture something that is accountable and pervasive. In all levels. So whether you're just a new employee coming to work at the practice, or if you're an employee that's been there for a long time, if you're responsible for onboarding or training a new employee, that this workplace culture is shared and promoted with that new person to make sure that they understand that this is a positive mental health workplace. So there are systems and measurement and follow-up in your toolbox. The other thing I wanted to tell you is that it's bilingual, which I think is fantastic to have that bilingual tool. So it is something that can be adopted in all provinces across Canada. You know what? In a nutshell, Kathy, this is the goal of the standard is to reduce harm and promote self-care. So reduce harm, promote self-care, give all the tools that are available to everybody in order to make that happen.
Fantastic. Thanks, Coral.
You're welcome. And you know what? They can find it at the mentalhealthcommission.ca if they want a copy of the standard. So that's all the words spelled out, mentalhealthcommission.ca. If you have an opportunity, also if you want to go there, I've also posted a copy of it on my website, which I think you probably have posted somewhere that they can get to it through there, and they can contact me, send me a message through there too.
That's a good reminder. So all of the resources, including Coral's email address and website, are in the document that's called Resources for Coral. And I'll just say right now, Coral, that your email address is coralpower@icloud.com, coralpower@icloud.com.
That's right. Yep. Thanks, Kathy.
You're welcome.
Okay, so a little more details about this, the standard. So we've gone through a bit of preamble about recognizing situations that would benefit from a workplace mental health policy. Now I want to talk specifically about what is the Canadian standard for psychological health and safety, how did it come about, what's all entailed with it, then a little bit of nitty-gritty, but not too overwhelming. Please don't get overwhelmed with this. I want to just make sure I give you enough information. So it was commissioned and published in 2013. And as you see on the slide there are multiple levels of government and mental health, workplace mental health specialists that were involved in developing the content for the standard. The standard itself actually is written by the Canadian Standards Association. Now, they also publish and make available other types of standards like ISO 9001 2015 or ISO 9001. And I mean, there's so many standards across the world, but basically what it says is that it's well written, it's thorough, it's auditable, and it's pervasive for all levels of the workplace or the segment of business that the standard is for. I know that it's been out since 2013, and we're now just sort of finding out about it and talking about it now in 2020. So it's been out for 7 years, and I have a little bit of information to share with you about these last 7 years and how amazing it's been for these workplaces. Mental health problems and illness are the leading cause of short and long-term disability in Canada, and the toll on Canadian workers and workplaces is substantial. I'm reading from my notes because this part is really important, and I tend to go off the cuff sometimes, so I'm trying to stay on my notes here. The workplace plays an essential part in maintaining positive mental health and creates psychologically healthy and safe workplaces and benefits Canadian workers and helps their families and communities. So creating a systematic and sustained approach for psychological health and safety, similar in spirit to how physical health, and I know we talked about this a lot already, but it's also becoming a business imperative is what they're saying. So the standard is important for risk management, and employers are being held increasingly accountable and responsible for psychological health and safety in the workplace. And that was discovered through the development of the standard and some of the data that was data that was brought into the study. As a result, employers can be held liable. So I'll touch on this. I think you might have a link there to share, Kathy, about the McShane reports.
Yes, good point. So that, again, that link to the McShane report is in the document called Resources for Coral.
Right. I'm sure that the people who have attended this webinar have had those feelings of, if they've been bullied or they've been harassed, or if they've left a workplace because of a mental injury, because they've been overworked and they're burnt out. And I think sometimes we internalize it and we think it's our fault, but actually this McShane report is pointing to the fact that workplaces actually should be and are becoming more and more accountable for allowing this type of either intentional or unintentional situation to occur at the workplace. So what it does, the McShane report outlines mental injury and the law in Canada. It sets a jurisprudence in Canada related to psychological health and safety in the workplace. So it can, like, the risk mitigation part is really important. There is a case that I know of in Saskatchewan where there was a public servant in a situation, and I know that this is a sensitive issue, but he ended up with a mental injury and he did die by suicide. His family is actually suing for the loss of their loved one, and this is the type of liability that we're seeing sort of more of through the data that was accumulated in this study. So I mentioned that workplaces across Canada care about mental health. So I have this great slide, and I'm sharing it from the actual data that was used and the places that have adopted the standard. So Via Rail, Rogers, Alberta Health, Sinai Health System, they have all implemented the standard and they've had it in place since 2013.
So, Coral, how long does it take to implement the standard?
You know, I'm glad you asked that because some of these businesses, they're very large businesses. So depending on the size of your business, it could take a shorter time or a longer time. But one of the big things that really affects the success of implementing anything at all at your workplace really is resources and time. So if you're already shorthanded because you don't have enough people on the floor, or your manager is struggling just to work on the HR, the strategic planning, the business management, then you need to really take a good look and don't stress yourselves out and don't get overwhelmed. Take this in pieces, like bits and bites, and do it small bits at a time. It may take you longer. It could take up to 2 years to become fully implemented with policies. But what we can do is I'm going to talk a little bit about tools that you can use to see which ones are most important at your practice that need the most attention right away. And also there's a new thing that I was thinking about of doing that I think you were going to share a little bit about some of the projects that I'm working on to streamline the approach at the veterinary practice level so that it becomes almost a systematic process. And we don't have to necessarily, if we really want to adopt this standard, but maybe the thought of it taking 2 years or 3 years is overwhelming. Let's streamline it and just get the stuff that's most important at almost every practice across Canada. Let's get that going first.
Yeah. You were saying that you're looking at clinics who want to join on and get onto the dashboard that you'll speak about, that you'll be collecting data from those practices and looking at the trends, maybe of the 13 standard, there's 1 or 2 that really stand out to you. And then you'll be writing a report on that and hopefully look at perhaps getting it published in CVJ, which would then be a stepping stone for other clinics to realize it's a good thing to do and not an overwhelming thing to do.
Yeah, exactly. I would just love for it to be, something that is not overwhelming. It's just something that's easily to adapt to any size practice.
And I just want to be mindful of time, Coral, just one moment. We've got about 4 minutes to the hour. Let's keep going to the end because you've got such amazing information. However, if people do need to jump off at the top of the hour, we won't, we'll be fine. We won't take that personally.
Yeah, we'll be fine. That's okay.
Do you remember that the webinar is being recorded? So if you do need to jump off early, then go onto the CVMA website next week and you'll find the webinar under the mental health resources tab.
There's so many free tools. I just wanted to mention all the tools are free, and it's just amazing. So makes it easy for a business case. Organizations like Alberta Health Services, they have 100,000 workers that are already being positively affected because they've adopted the Canadian National Standard for psychological health and safety. So there's actually over 40 workplaces right now with probably well over 2 million workers that are being positively affected by psychological health and safety policies. Families of workers, communities, clients, and patients, they're all getting the benefit of adopting the standard. The interesting thing is I haven't seen one veterinary clinic at all on here. So I know that this is really new and very exciting to be able to share this right here. And I really thank you, Kathy, for this opportunity and Mark for supporting mental health in the veterinary profession. It's so important. There's actually a mental health strategy for Canada. Out of all the places in the world, here in Canada, we actually have a mental health strategy that recommends the wide adoption of the psychological health and safety standards in Canadian workplaces. So I can easily ramble on, but I can easily wrap it up. So I'm going to wrap it up for everybody here. And here's all the tools and the links that I've included of all the free tools, and download those and make sure that you have those. Log into the Guarding Minds at Work dashboard. That's a picture that I've included on this slide. That Guarding Minds at Work. If you're excited and you really want to get started, that's the place to go to get yourself signed in. Create your own dashboard. It's the best tool to collect data on what you need to do at your workplace. Out of those 13 psychological factors, what is the most important one for you to change or improve, and what are the ones, hopefully, that you're doing right, that are working for yourself and all your workers. So I want to just recap that we have shared there are 4 phases to the implementing the standard, the Canadian Psychological Standard for Health and Safety. We need a leadership commitment, first of all, and I know, it's just natural. You get so excited. You come to get this new information, and you want to start talking about it. But remember, you need leadership commitment, and I would love to share more information about how to do that and give you those tools. We spoke about how a policy can improve vet practices and the community, what a policy statement looks like from senior management that is signed. You have learned a lot about the standard and where to find it, and the risks of doing nothing are obvious to those here. as well as the legal implications that I mentioned. I want to also mention that the standard is free. It's a free document, Kathy.
Isn't that amazing, Coral? Because I think you've mentioned to me that some of these standards that are put out for workplaces cost thousands of dollars for workplaces to purchase in order to implement. And some of those standards are required by law. So that's not only expensive, but also necessary.
It's so great. It's totally. And so the business case is not complicated, is it? I mean, it's free. Just start, right?
Exactly. Yeah.
we just gotta give you the right tools to get started, and you'll be on there. So the stigma of mental health really is beginning to allow us to form different and compassionate attitudes towards mental health in the workplace. It's reducing the stigma. This is the time. We now have a robust and available tool to help us put the tools in place to mitigate our mental health struggles. And we don't want to stand by and see our coworkers struggle. We want to have a way to help them. So what I had mentioned here on this last slide is that there is a way to go and join the movement. There is a portal where you can commit to the psychological health and safety. You'll get a certificate. You can post it in your waiting room, in your staff room, and be so proud to be part of that movement. And I really want to reaffirm to everybody that you're not alone, that you yourself right now are feeling like you really want to do this. I'll bet you anything somebody else at your workplace is too. So share the excitement with them, share the free tools with them. Have that talk.ca is a great starting point. And thanks again, Kathy, for inviting me to this webinar and sharing this great resource.
You are so welcome, and I am so grateful that I met you, Coral, and also using that word proud that you just mentioned. I'm proud that you are the first vet professional in Canada to be certified to implement the psychological health and safety standards. And may I put that out as a challenge to others who are on the call today. Maybe it's not you on the call, but maybe you know someone in your veterinary work environment who has that passion to take the certification from the Canadian Mental Health Association. And then I'm hopeful too that the next time you go onto the dashboard or I go onto the dashboard, there will be a veterinary clinic there. That would be the first one in Canada. Yeah, it's exciting.
That would be.
So,
I know, that would be so exciting.
Yeah,
definitely. I would love to see that.
Well,
and if there's any questions,
I'll go to the question chat. And so please, if anyone has questions or comments, put them into the chat under the question mark icon. Currently, there are no questions and no comments. I'll keep an eye open there. I'll just remind people, I see people are jumping off. I want to say thank you for joining. For those who are mothers, happy Mother's Day on Sunday. And a reminder that Coral's email address is coralpower@icloud.com. And the webinar will be recorded and will be posted. Coral and I are going to stay on the platform for another few moments in case anyone has questions or comments. Yeah, so it's currently there's no comments, no questions. Grateful for your time.
That's great. Coral. Yeah, that's awesome. I'm hoping that everybody gains some amazing information. They're going to check out those links. Explore what it is, like how it is that these policies will work in their workplace. And as I mentioned, I would love to have an opportunity to share more information about how to talk to leadership teams about this, because that can be intimidating sometimes too.
Yeah,
and it sort of depends.
Yeah, it's hard.
Yeah, that's right. And sometimes you start talking, and if they don't share the same opinion, you internalize you kind of take a step back. But just know that you're on the right path, and just keep taking baby steps towards getting there.
Yeah, and I think appealing to the values of higher management. Maybe for some people, they need to see the data, and the data's there from all those organizations that you shared. Maybe it's appealing to their value of concern about money. Well, the standards are free. And yes, it will take resources to implement them. However, like you say, take baby steps.
Yeah, that's right. Yeah. Nothing, just any baby step is a good step.
Absolutely. Even just to get the conversation going. So far, no comments, no no questions. A number of people are still on the phone. I was thinking back to that slide you shared of all the organizations who have implemented the psychological standards, including I'm here in Alberta Health Services. I've got a number of friends who work for Alberta Health Services. And I got to thinking maybe people who are on the webinar, their partner or their spouse or a friend may work in one of those organizations. And that would be a good person to turn to ask them. So how does it feel to be in a workplace who has implemented those psychological health and safety standards? Like Rogers, I know you were saying earlier, where we all moan and whine about our cell bills. However, and there's more than just Rogers as a provider. I get that. However, isn't it great? How many, you said, I think they've got thousands of employees?
30. There's 30,000 employees. 30,000. That are positively affected. Protected. And, it's just great to be able to say, I'm not feeling my best today because, stuff happens. You're at work most of the day, you go home, something happens at home, makes you feel emotional. You're supposed to go to work the next day. But you know what? It's okay to not feel yourself. And it should be okay to share that with your colleagues and your coworkers. And sometimes, honestly, I've done that myself, where I've said, I'm just not myself today. And they share with me that they're not themselves today either. And so then we have a good laugh, and it feels really good, and it's just a positive place to be.
Right. Yeah, absolutely. I see that a number of other comments have come in. Maybe Wi-Fi was having some issues, or perhaps I was, but I'm seeing comments working so hard to reach level of success. Now my boss wants me to teach another person, but I have a feeling in mind that once I teach that person, I will be asked to leave because they have an alternative. That certainly is a struggle. However, I think the data shows, Coral, that workplaces where there is a good mentor-mentee relationship actually allows people to have more sustainability in their work environment and less likely to be pushed out the door.
Yeah, exactly. You know what? We can't afford in this industry to be shorthanded much longer. And that's why I think it's so important to look after our mental health. Thank goodness in the last couple of years, we've heard more and more, we've had more recognition in our profession that we need to do more to protect and promote our mental health in our profession. And I think by remembering that we want to continue to flourish at our workplace, and it's a great opportunity to be able to teach and mentor somebody else. I think that it speaks to the value of that employee that they've been asked to mentor somebody to pass along that value and those skills to another person. I can understand the feeling, and I think what they're trying to allude to is that they would probably like to be able to talk to or ask senior management, what's the plan? Like, am I still going to be here, right? A mental health policy would have a communication policy that states that that's okay and that you can have those conversations with your manager. When you have a chance to look at the standard, there is an audit tool, and it specifically outlines communication policies.
Great. Thank you, Coral. Another comment and question, what's your recommendation for employers who refuse to acknowledge or take responsibility for mental health and implementing company policies because they want to avoid anyone taking legal action? Essentially, it's not our responsibility.
I'm so glad that you asked that question, because there's actually a precedence to show due diligence. If you don't have a workplace mental health policy and there is mental health harm, and if there is a liability and you do go to court, then you are protected in court because you've shown due diligence, because you are implementing a mental health policy at your workplace. It actually goes against you to do nothing in that case, because you can be held accountable for doing nothing. I hope.
Great. Yeah. Great acknowledgement of that. I'm noticing a question about, are there free counseling resources, not suicide prevention lines, for those who do not have access to employee family assistance plan services? And that is what Homewood Health is offering right now with Health Canada. So Googling that and getting onto their portal allows for free one-on-one counseling, free group counseling, as well as peer coaching too. I'm seeing a lot of comments saying thank you. I'm also, which is wonderful, I'm also seeing questions about what does it take to get certified, which is a wonderful question.
Yes, I'm so glad to hear you say that. There are tons of resources on the Canadian Mental Health Association, so the CMHA website. You can go under training or resources. They have a lot of different training programs that are available. Anything from a couple of day courses to a week-long course. This was an intense 2-day training that took place in January for me, and thank goodness I got my training and my certification in January. So I was able to, start the year off on the right foot and excited to have this new knowledge. It teaches you a lot about any type of workplace, any size workplace, and the training that you take, it's a real life scenario where you are trained to assess an organization, implement a tool to help that organization implement the policies, and do the continuous improvement and follow up. So the training that I took, it was in Winnipeg. It's a 2-day course that I took, and it was a full day, full 2 days. And then there's a declaration that you sign to say that you are now going to be held accountable as a advisor, and that you uphold and commit to a code of conduct and ethics as an advisor as well. And across Canada, I do believe on the Canadian Mental Health Association website, you can click on your province and you can see who has taken their advisor training. And so you can actually, on some of those, you can actually contact a live person that's in your province as well.
Good suggestion,
they may
Cora.
not,
yeah.
And they're from a lot of different backgrounds too. So it just gives you the opportunity to have somebody, if you need somebody come in your practice and help you implement a few of those, or do an assessment or speak to the manager, or present the business case, because sometimes as a frontline worker, you're not going to feel really comfortable presenting a business case. You might need an outside person to come and help you present a business case. Sort of have that awkward conversation about, don't do nothing, we need to do something.
Right. Yeah. So it's a good way to leverage those people who are perhaps even in your community or your province who are already certified, and they may not be all that familiar with veterinary workplaces. However, the standards are the standards, and they apply to all workplaces in Canada and should be implemented. And someone, and I love the question, said, the resources, they're free, or the standards, they're free? Yes, they are. So I think the reassurance that although you're certified as a psychological health and safety advisor, Coral, we don't need to. So if somebody's in a vet clinic and wants to start looking at maybe implementing 1 or 2 of those standards, they can go to the website, Mental Health Commission of Canada website, download the standard for free, and then start working through it.
Yeah, start working through it. And there's so many great resources, just understanding and being more comprehensive in your understanding of what it means for your workplace to have that policy. For me, in my background, I just, having worked and been in so many practices and understanding and hearing the trends about veterinary medicine, I just felt that I wanted to do something to contribute to.
Oh, I think we're losing you again, Coral. You may want to refresh. And as Coral refreshes, I see that there's another question. Is a copy of the statement, the management character, in the resources provided? Yes, that would be all within the standard itself. So going to the Canadian Mental Health Association website, finding the standards just in the search bar, putting in psychological health and safety standards and downloading it would have that charter.
Yeah, it would have that.
Awesome. You're back. Thanks, Coral. And then I saw one other comment. I'm just scrolling through the screens here about gossiping around COVID. Being bombarded 24/7 with COVID-19 news updates. Please, can we stop gossiping about it in the workplace? All it does is heighten everyone's stress and anxiety levels. And I think we all need different levels of information and different types of information. Some of us are very focused on statistics and knowing how many new cases there are. However, I think we all need to be sensitive that everyone is going to show up differently to what they want to hear or not want to hear. So I agree. I think the gossip, there's a time and a place to talk about it. And if you're feeling like you're getting too much of it from your coworkers, put up the boundary, say, this is too much for me right now. Please stop talking about it. I think we all have to take ownership in recognizing when people are looking overwhelmed and stopping, or ourselves saying, I can't, please. I know maybe it's important for you to talk about the statistics and talk about what you heard on the news today, but not right now.
Right. I agree. I think you're right. Just setting the border, like what you can tolerate and what you can't, and being assertive and strong about what it is that you need to do in order to protect your own mental health. And even say, you know what, I need to protect my mental health, and I just can't listen to this right now. It's not going to be good for me. So, if we're going to spend some more time together, I just wanted to share that with you. And I also wanted to know from, and share back and say, I just want to know, like, is there something that, you're struggling with that I can help you, just sort of know that I don't talk about something that's, upsetting you. And I think it's, I did a presentation and we had a really great circle up, a little roundup with all the coworkers. And I asked the question, what happens when you have a mental health problem, when you're suffering at work, when you're feeling down, when you've had a tough day, there's a trauma, what do you do for yourself to make yourself feel better and cope with that? They all had different answers. They all had what works best for them. And I think by sharing that and everybody had a chance to know each other's mental health better. Mm-hmm. And it was a great sharing circle opportunity, and it just brought the team together.
Beautiful. And then people know how others want to be treated. They're getting to know people in the workplace as people and not just as a coworker. They're getting to see different styles of how they want to be communicated with. Mm-hmm. Nice. Good suggestion.
Yeah. I mean, I think it's it's great for management to act as a facilitator to help our coworkers all talk about that, because we all have different personalities. Even especially if you're in a toxic work environment, maybe you are being bullied or harassed, you're not really going to feel like saying that to that person that you're in the room with, like, you don't talk about that right now. You probably do need a forum where there's more people around and you're being asked specifically to share, right?
Mm-hmm. Yeah, absolutely. A reminder to some of the comments I'm seeing in the chat. Yes, the webinar is being recorded and will be posted on the CVMA website early next week. And I think that pretty much captures all the comments and questions on the chat.
Great.
So it's now coming up to a couple of minutes past the quarter mark. 12:17 for you, 11:17 for me. How are we feeling? Shall we ask the webcasting portal to close down the webinar?
Is that I've had a great time. I love sharing this stuff. I get so passionate. But this has been great. Thank you so much, Kathy, for allowing this time and the space to be able to share this information.
I love your passion too, Coral, and I think this is worthy and deserving of another webinar. So we'll look at an opportunity to maybe have people reach out to you, coralpower@icloud.com. And if they're ready to start implementing the standard, maybe we get a cohort of people together and offer another webinar more on the implementation piece.
Yeah, I'm there.
Wonderful. Well, thanks for your time. And I appreciate the webcasting portal team in the background. Thanks again to Laurie Tarbett for all you do, Laurie at the CVMA. And I wish everyone a really nice end of Friday and have a wonderful weekend. And again, happy Mother's Day on Sunday. Take care, everybody. Be happy, be well.
Yeah. Thanks, everyone.